8 healthcare workers have succumbed to COVID-19 since the onset of the disease in the country 5 months ago. The death of registered nurse Marian Awuor is the latest, and one that has now pushed the National Association of Nurses to question the level of preparedness in handling of the COVID-19 patients in the entire country.
At 32 years of age, registered nurse Marian Awuor breathed her last at the Kisii Teaching and Referral Hospital, where she was admitted after contracting COVID-19. Earlier today, her colleagues at the Rachonyo Sub-County Hospital in Homa Bay County came together in prayers to remember their colleague who had given her life to diligently serve those in need despite being 8 months pregnant. Marian is the third registered nurse to have lost her life in the country to the COVID-19 disease.
Marian Awuor Adumbo, a 32-year-old registered nurse, used to render her selfless service at Rachonyo Sub-County Hospital. She passed on at the Kisii Teaching and Referral Hospital yesterday evening. She has left behind her less than a week-old infant that she delivered at the hospital. Her death brings to 8 the number of healthcare workers that we have so far lost to the disease in the country.
The National Association of Nurses now wants the county governments to reassure health workers that their safety is of utmost priority to the governments, as it was just a few days ago when the Kenya Bureau of Standards recalled masks that had been issued to health workers in Kisumu.
Even as the nurses and the health care workers are donning the PPEs, they get torn in the process, even before they go to the clinical environment. We've examples of masks. You cannot even call a mask. Maybe it's been extracted from a leso.
There could be PPEs that might be substandard being provided through our sources. We are very vigilant in making sure that the products that are used there, any health products and technologies that are out in use there, meet our requirements, our regulatory requirements and our standards.
So far, over 600 health workers in the country have been infected with the virus. The rising number of infections among them seeing some clinics and health centers shut down to contain the spread of the virus.
The government and the employer has neglected their duties, and I'm telling you, in the next few days, the health workers will not be able to perform their duties as expected, and then we'll find ourselves in a mess.
The National Association of Nurses demands that county governments should employ more health workers who have been adequately trained before the health system is overwhelmed by the COVID-19 pandemic. Raka Muigai, Citizen TV.